What's going on? I just wanted to give you guys an update, and I just wanted to talk and just let you ladies know what's been going on in my world. I hope everybody's been having a great winter holiday. Christmas is coming up. Thanksgiving came and gone, so this whole shopping thing and everything, and everybody's working to the bone and can't wait to get off these couple of days. So I just wanted to give you ladies an update to let you know what I am doing. So right now I am 5 weeks and 5 days. Y'all, I feel so drained and so tired. I actually feel I'm actually tired right now, but I was like, I gotta talk to the girls. Okay, so so I had a doctor's appointment this past Monday, and I went to see my doctor, Dr. Pay, and this was basically a follow-up appointment because I hadn't seen him since after I had lost Harmony. I did ask him about the TAC, about the transabdominal cerclage. He told me he didn't do it, and that was it. He did offer me to give me some birth control, and he told me that it will happen again as far as me dealing with the loss. And I haven't seen him since then. And so what ended up happening was after I had got, and what I explained in my last video, after I had got the TAC put in by Dr. Davis in New Jersey in June, Dr. Davis had asked for the information for my OB so he can basically send the instructions down of what I had done and things like that. So in October, when I was actually just doing a follow-up with my OB, just to, make sure everything is fine down here, whatever, because I never did a follow-up after the TAC, and I wasn't told to, but I just needed to, just get a follow-up and everything, a physical. So when I spoke to them, they were like, no, we didn't receive anything, and I was like, y'all didn't receive anything? Like, what do you mean y'all didn't receive anything? It was like, no, we didn't receive that you got surgery done. And so I was just like, whatever. When I go to my appointment, I'm sure he's going to do a sonogram and he'll see the TAC right there. So he'll know later on, and I'll probably get the paperwork. So anyway, I show up for my appointment. And y'all, I'm in there, and there are women with huge bellies just plop, just like, and I'm like looking like, oh man, here we go again, and they were huge bellies, and then there was this little baby boy. I mean, he had to be like maybe 3, and he was screaming, and I was like, anxiety. So anyway, I go back there. Well, when I go up and I speak to the little nurse or whatever like that, she's like, yeah, we do have your paper that you got a transabdominal cerclage. I was like, really? You do? She said, yeah, the day I spoke to you, I called them and they sent it over. And I was like, that's so awesome. So it wasn't like I was going to be going in the dark, like he didn't know what I, got done. So I was waiting. And then, I was thinking because they were like, what are you here for? I'm like, I'm pregnant. And they're like, oh, really? So they took my weight. Y'all, I was big as a house. I think it was the boots, too. The boots must have put on that weight, because for 4'11", I am not supposed to be 150. I wanted to say, let me take my shoes off and do that again, but I was like, whatever. So, anyway, they put me in that room, and they told me that I had to take off all my clothes or whatever like that. And which I was really surprised, because, when most people find out they're pregnant, they do blood tests to confirm it. Not this doctor. He's going to do a sonogram to confirm it. So He came in. He said, "Oh, nice to see you again, Ramona. Nice to see you again. Also, I see here you got a transabdominal cerclage." And I'm like, "I did." He said, "Oh, let me see. How did you get it done?" I said, "I got a robotic laparoscopically or lab tech. So it was a robotic laparoscopic transabdominal cerclage. So he did it laparoscopy. So I showed him my scars. And he said, "Oh, good work, good work." And so I felt pretty good. I was like, "You think this is good work, do you?" He was like, "This is good work. This is good." He said, so you are pregnant now?" And I was like, "Yes, I am pregnant." And he was like, "How many weeks are you?" I said, 4 weeks. And I think it was 4 weeks and like 5 days. And so he said, "Okay, let's see. So he gave me a transvaginal sonogram. And I know they put that little thing down. Let me show you the picture real quick. They put that little wand thing in you, and there was my little bean. It showed like my cervix was closed. So it showed all the darkness and my little bean just sitting in the middle. He said, You're right. You're 4 weeks and 5 days," because I was measuring right what I was saying. And he said, "Oh, this is excellent work. I mean, y'all, he was really excited about the TAC. Like, he was like, "Look at this." And he showed on the inside of where the TAC was. And I really wish I would have took some pictures. And I'll do it later on. So he told me to see him in the next 2 weeks because it's still too early, but he did say congratulations. So that was my confirmation that I'm pregnant, and also able to see the sac and everything in there. So I'm just praying for a heartbeat. Symptoms, right? Oh yeah, he did say this as well, that he wants to refer me to a high-risk doctor. He said he does not mind caring for me, but he definitely believes that I need to be with a high risk, and I definitely agree. He said I can go back and forth, but with a high risk, they will measure me like every week or something like that, and I'm like, yeah, I need that. So we had agreed on that. I'm still thinking that maybe I should go back and forth with him, and I'm hoping he would become one of those doctors that would start to try to learn the procedure, and maybe the transabdominal cerclage can be available for people in the Virginia area. So that was really exciting. He was really excited about that. He did ask me again how many losses. I said I had 2, and he was just like, "How did you find him? How did you get the tag?" I said, "I Googled him." "You went all the way to New Jersey?" I said, "I sure did." You had to pay. That's my insurance did. Like, this wasn't free. So he was just really amazed. Like, y'all, I took everything into my own hands. And that's all I can tell you is to take it into your own hands. One lady is online right now talking about her doctor wants to do the wait and see approach with a TVC. And everybody who's had a failed TVC is like, hell nah. But every pregnancy is different. But me personally, I can't even speak highly of a TVC because it just didn't work for me. So I told him, bottom line, that I don't want to lose any more pregnancies. I'm not. And as y'all can see, y'all, it's time for tea. So get your teacups up. And that's sip to 40 weeks to go. Trying to conceive. Praying for a rainbow. Praying for a positive. All of that good stuff. So, yeah, and I'm sorry, y'all. I know I sound so tired because I am tired. I was taking my 1-a-day multivitamins, but then one of my friends basically was telling me, "No, you can't take that because that has antifreeze in it or something." And I looked it up online. I was like, "Are you kidding me?" So I'm trying to look up these pills right here. These are the multivitamins, One Step, that I got from CVS. I've been had these, but the expiration is not until 9/15, so they're good all the way into August. I haven't really started. I think I probably started taking them. Yeah, I started taking them with my last pregnancy. Okay, symptoms. My symptoms that I've been having: constipation, huge. And if y'all go back into the archives and when I was pregnant with Harmony around the same time, I had constipation. I mean, y'all, I've been like, oh my goodness, gas bubble. Moody. I've been so moody, and I've been telling myself, like, "Mona, you need to chill." I've been moody. Like, I've been like, dang, you know, I don't want to be moody. And I don't want to, and another thing too, I don't want to gain weight in this pregnancy. Now, my last pregnancies, I was like, I don't care. You know, I don't care if I have cankles. I just want to be comfortable. But this time, I just don't want to, I don't want to be gaining weight and then have to hit the gym and all that other stuff. I just want to do things in moderations. Cravings. Yesterday, the cravings was crazy. I went all the way to Maryland. Then I had to go to DC because I was craving for some crabs, some steamed crabs. So I went to the wharf. If you ever know what DC is from DC and know what it's all about, I went to the wharf, got me 3 dozens of crabs, and I was just clack, 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 clack. I was eating them. I was like, clack, 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 clack. I mean, I was eating them. And then all of a sudden, I was just like, I don't want crabs anymore. I want some chocolate chip cookies. I was like, Matt, please, babe, could you please go get me some cookies? He said, all right, babe. And I said, make sure you get the Chips Ahoy, the soft ones. He didn't have it. I said, get some juice, too, because I just wanted to take the cookies and dip it into juice because I don't like milk for some odd reason. Y'all, my craving was just crazy. But I'm not really craving today. Today, I felt like I wanted to throw up. Like right now, even saying throw up, I just feel like I just want to throw up. My husband was laughing at me because I was walking downstairs and Solo was looking at me. And I said, Solo, I just want to throw up all over you. And he was like, babe, did you really say that? And he's all laughing. I'm like, yes, I just want to throw up on Solo. So, y'all been feeling like that. Them kittens, y'all, been waking up, and them kittens, they know how to climb in the bed now. So could you imagine I'm sleeping and I feel something moving and little fur balls are sleeping next to me? Like, where they do that at? I'm like, excuse me. Y'all supposed to sleep in your own little thing. And they're like, but it's comfortable here. But I've been dealing with that. What else? Oh, yeah, so, you know, I was talking to my friend, and this is not the first time I've heard this, and I said that I was going to mention this in my video, but before I go into that, first of all, I want to congratulate all you ladies for the TTC giveaway. I didn't have any special store requests whatsoever, so I had the TTC giveaway, so it's 3 of you that is receiving the package, and also 1 of you that I reached out to because I need to get your address. And congratulations to all of you ladies. You're getting 60 ovulations. Y'all, sorry, we got cut off again. But yeah, again, congratulations for the TTC winners. You're getting 60 ovulation tests, and they're strips. And you're getting 30 HPT tests. I was actually trying to look for some new ones. I will say that the OPKs, they really work because they told me when I got a surge, so they were dead on. The HPTs, they did not work. As a matter of fact, I ran out of them before I could actually start testing after 11 DPO because y'all know I got my positive at 10 DPO. But when I had 1 strip left, I got a negative with the strip, but got a positive with the dollar stores. So, yeah, I was trying to see if I can find more bulk dollar stores, but I couldn't. All of this stuff that's going on in this time frame, the seasons, holiday shop, and I just wanted to make sure that you ladies did get your stuff. So I sent all of you guys the order confirmation. It takes forever for it to get there because it's coming from China, but when you do get them, it's worth it, and hopefully maybe some of you ladies will be pregnant before then. Okay. So, congratulations to that. And please let a chick know when you do get the package because I want to make sure they sent it. But, yeah, so that's pretty good. And a lot of people are going to be getting their BFPs soon. Some of you ladies are actually going to be leaving out of your first trimesters into your second trimester. So that's awesome. Y'all, this whole TCC thing is just a journey. It's a journey. It's a journey. Other than that, yeah, I wanted to talk about, I was speaking to my friend the other day, and me and her, we were just online chatting, and she was telling me how, you know, she went to go see her doctor, and that, you know, she told her doctor, she just recently, I think about 6, 8 months ago, she got a Dr. Hannity TAC. And so now I believe she's been trying for 6 months, but she's dealt with multiple losses dealing with IC. And now that she has her TAC, Dr. Hannity gave her the go to basically try for a baby. And so she has this new doctor, which happens to be in Florida. And she goes to him and tell her about her past history. And he blatantly tells her she shouldn't try again. Why don't she adopt? And I was like, he said what? And she was like, yes, I wanted to cry. And I'm like, he said what? And it really pisses me off because I'm like, where do these doctors get off? You know, you're supposed to practice medicine. I mean, I would think your job would be to try to come up with a cure or try to help. You know, I know they're not God. Like, I know they're not, you know, the Lord. I know they're not God. But I would think as a doctor, you're supposed to heal. Like, it's been a lot of discouraging doctors out here. And it pisses me off because you don't know this girl's journey. You don't know what her desire is. She didn't just put it upon her heart just to have a baby. Like this woman, it didn't just come out of nowhere. You know, I believe that God gives us the desire to want to have children. And for someone to try to take it away, like medicine has revolved in such a way. I was just reading that a lady had a cervix transplant. I mean, and she was able to carry full term. Now, if that doesn't tell you that miracles can happen, then what? But for you to tell me to just blankly give up, I told her, girl, if you don't hurry up and get pregnant, go full term and laugh in front of his face when you have your baby in your arms. Like, yeah. And then I had another friend who, before she went to get the Dr. H in pregnancy TAC, after which she just went because she just had a loss. A doctor was telling her to do the wait and see approach, and that's give you a TVC, and try to discourage her from getting the TAC. And when she told him, no, I already got plans to get my TAC in the next week, he laughed at her. And I said, he did what? She said he laughed. I said, he laughed at you? You must think this is funny that I'm losing babies, the babies that are dying in my arms, huh? You must think it's funny that my cervix just opened up. Oh, you must just think that's funny that I'm taking matters into my own hands and that I'm doing research. Oh, you just gonna laugh at me, right? So, you know, I was like, what's his name? Because, you know, I was ready to put his ass on blast, but I said, I ain't gonna do that. But everybody got to take things into their own hands. So she actually went and she got it done, and I'm so happy for her. And I can't wait to sit to the side, eat my popcorn, watching her go full term. But these doctors are a trip out here. They would tell you everything in the book, and then the minute you lose your baby, it's oops. Well, next time, what we can do next time is this. Oops. And then they go about their way. And then when you come back, they be like, who are you again? Looking in the computer. Because you're just a number. I'm sorry. Some doctors have passion for their patients. And others just don't give a damn. Like you had the one lady. She went full term. But she dealt with exactly what I dealt with my Melody. When she went to the hospital, her doctor saw that her baby was already there in the bubble. But this doctor had passion. He pushed that baby up because he was like, not today. He pushed that baby back into the cervix, and he closed her cervix. He put a stitch on her, and she went for a term. And I was thinking to myself, why couldn't I have had a doctor like that? Because nowadays these doctors are just like, no, they just give in too much. And I'm not saying that there are not good doctors out here. But from my experience, from the 3 doctors, from the 2.5 years that I've been pregnant, off and on, going into my 3rd year, I've only really met one doctor. I mean, even the doctor who delivered Harmony, he tried. He did. But see, he thought that if he put a stitch on me at 17 weeks, then everything's cool. But he didn't know my cervix, that I started to basically open at 14 weeks. So you can't tell somebody, oh, we'll do it this much, thinking, oh no, the weight's, I mean, maybe it would have been different if I did it sooner. But I had one girl that said, don't feel bad, because I had mine on at 11 weeks. I just honestly feel like these doctors should have talked about a transabdominal cerclage. And then I'm hearing that most doctors that are not educated about a transabdominal cerclage, they're the biggest ones to tell you not to get it, and because you have to deliver C-section. But I would say like 40% of women nowadays are getting C-sections. So that's not uncommon. Just about everybody I know got a C-section. So I don't care. And that's another thing too, when I went back to do my follow-up, I did tell him that after I got my transabdominal cerclage put on, that the doctor told us, Dr. Davis told us to try after one cycle as soon as possible. I said, but we decided to wait 6 months. He said, oh, I see. And the reason why we decided to wait 6 months, because we wanted to go to Disney World and we wanted to have a good time. That's the only reason why we waited 6 months. So he was like, oh, okay. And because I wanted to be like, remember when you told me? He didn't tell me not to try, but you pretty much didn't give me no hope or nothing to go off of. So, you know, I think it was very discouraging when I'm hearing my friends and they're telling me that these doctors are laughing at them or have nothing but negativity to say. So I will say this to the MDs out there. Y'all need to get it together. Y'all need to go back to the passion of trying to help, trying to find a solution to the issues that's out here. Not everybody is just a straight give up. Don't give up on your patients. If they're not giving up, then you have no right to give up on them. And that's it, and that's all. Some of y'all may agree, some of y'all may not agree. I don't care. But after dealing with 2 damn losses, ain't nothing you can tell me. Ain't nothing you can tell me. Nothing. So you didn't get a referral? No, I didn't get a referral. What am I need you to tell me that something's wrong with my cervix? I know something wrong with my cervix because it happened 2 times. So I want it shut. Okay. And I'm going to tell you something too, you know, because I got real sweet friends, you know. If a doctor would have laughed at me, he would have got his ass cursed out. What, you laughing? You think it's funny? But let me stop, y'all. Let me stop because I'm trying to get in a good mood. So that was really something. So ladies, just don't give up. Don't give in. I've heard a lot of stories about women who've gone full term with TAC rainbow babies and even getting a TBC or TBCIC. Just know your history, know the percentage, and know what you're doing before you do it. You know what I'm saying? And you have to make that right decision. Don't let somebody say, well, let's just wait and see. What do I look like? What do I look like? So you just gonna wait and see if it's gonna fail, and if it fails, it's gonna be like, One of my friends told me when she lost her second baby dealing with IC, she told the doctor that she was going to need a stitch, and he didn't give the stitch. And then when she lost her baby, he said, maybe you do have IC. I was like, what? These doctors are a trip out here. And I'm going to tell you, if you look back into the archives, I had a hard time looking for a really good doctor, because when I would go to them and tell them what I needed, the doctors would be like, oh, I don't know if you need that. But then I did need it. You know what I'm saying? Like, you got to know your stuff. You got to know your body. And just pray for the best, y'all. Pray for the best. So, that's pretty much it. That really pissed me off. I can't believe these doctors out here. I really can't. I just can't. I mean, it's just ridiculous. And that was another thing, too, when I did my follow-up. He said, you do know that you will only be able to have the baby C-section. And I wanted to say, you do know that when I had both of my babies, naturally, I lost them both, right? So do you think I give a damn about having them via C-section? Blink, blink, blink. Nah, y'all. I know. I told him, yeah, I know that. Excuse me, y'all. Excuse me. It's just some of these things. It's just a piss. But everything went really good. Faith, get in the mountains. And I'm out. That's my cat talk to her. Come here, some mountains, hollow. And sit down. And I'm out of the toes. And sit down. And I'm out. It's a facita. I don't go see the facita. I don't go sit down. Yeah, but y'all, everything went really good. Everything was good. So in the next 2 weeks, I actually go for my follow-up. And then I'm hoping and praying that we do get a heartbeat. I will say that I've been feeling a lot of pulling, constipation. I do feel that even with this transabdominal cerclage on me, I do feel a difference. If y'all know what I mean. I know y'all probably like, it's too soon. Well, if you kind of know, this is my 4th pregnancy. And I do feel a little different. Like, I don't know. Like, I feel like something's expanding, but then something's holding it. I don't know. So, yeah, I do feel that. And I'm praying that we do have in the mountains. And I'm eating in the house. And I'm out. I'm praying that we do have a heartbeat. And I can see that in the moon. I'm praying that we do have a heartbeat in the next 2 weeks, but I do feel morning sickness. I do feel pressure down there. I have not thrown up, and I don't want to throw up. Y'all make sure y'all really bundle up out there. One of my friends, she's just getting over a cold, and I just do not want to have a cold. How do I feel now that I know that this is my 4th pregnancy? I'm excited, but at the same time, I'm not really feeding too much into it. I'm more so like, I mean, I read somewhere too, and somebody had put on a forum that it's like I'm afraid to get close because I feel that if I lose this baby, then I'm going to be crushed. And, I have a friend that's like, no, you can't feel that way. But then I also feel like, I know that it doesn't matter how many losses you have, but I kind of felt that after my second trimester loss, that I wasn't going to deal with that. So my happiness with Harmony, I was like, this is it. And when that didn't happen, it was just like, this is so real. This is like a nightmare. I can't believe this is happening. And so I really feel that when I hit 24 weeks to 26 weeks, that I can start to relax more. Everybody says 24 weeks, but I had a friend and she lost her baby girl at 24 weeks. And it was devastating to her because she kept saying everybody talked about this viability stage. And so I totally understood what she was talking about. So I'm just really hoping and praying that baby is okay, baby is healthy, and that, come August, that we will have a full-term pregnancy. I would really love to experience it. It's hard for me to see that. I mean, with all of my babies, I thought about how they would laugh, smile, and I even think about that with this baby. But it's really hard when you went through what you went through. And I know that's normal, and, some people say, well, think happy thoughts. I thought happy thoughts last time. Maybe if I do things differently, it'll turn out different. I don't know. Or maybe I shouldn't even feel that way. I don't know. But y'all kind of understand where I'm coming from. One of my friends did ask me, did I take a Chinese predictor kit? And I said, not a kit, but a Chinese predictor. And I said, what's that? So it was online, and I went ahead and I took the test. And it basically lets you know gender prediction, whether or not you're going to have a boy or girl. I feel that I may be having a boy because we didn't find out we were pregnant until 10 DPO. But my husband says, well, girls are slower swimmers. I'm like, yeah, but the last 2 pregnancies, I didn't find out until like 8 DPO. But I don't know when I found out. I know with Melody I found out like a couple of days before my period. So maybe that was around 10 DPO. So how do I feel if we're having a girl? Hey, I got all of this pink. It's going to be put to use. And I'll be getting even more pinks, yellows, greens, and things like that. How would I feel if we're having a boy? that all that pink will change to blues, and I will be super excited. I care less if it's a boy or a girl. I just really want a healthy baby in a full-term pregnancy. So right now, I do feel like the weeks are flying. Some of my friends are like 11 weeks, 12 weeks. One girl's 20 weeks. I'm like, dang, y'all pregnancies are flying. So when I look at somebody else's pregnancy, I feel like, okay, when they're due, I'll be, what would I be? I'd be like 10 weeks behind them, maybe. Would I be 10 weeks behind them? No, when they're due, I'll be like maybe 7 weeks behind them. So I know, like, oh, my time is coming. I think I told y'all before how I feel about, especially looking at these videos, these TTC videos. I don't even really look at them no more because there's no new videos. I've seen them through all 3 of my past pregnancies. And so it has the year 2012, and here we are. Today is the last month of, well, this is the last month of 2014. So I'm going into 2015 with a baby. I'm just praying that this is going to be our year. I'm so tired of people judging me in their minds. They don't say it out loud, but I know they're thinking like, oh, Mona can't have, and this and that. So I'm really praying that in August that we will have a bundle of joy. I'm super excited about it. I do feel sharp pains in my vagina sometimes. I do feel stretching and pulling here and there. Definitely nausea. Also, too, I've noticed I went up a bra size, or cup size, should I say. I went from a 34C. Wait a minute. Yeah, I went to a 34C to a 36C comfortably. So I was like, wow. Or maybe I've been needed that. I don't know. But that's it. So until then, ladies, I'm going to definitely give y'all another update. I'm sorry, y'all. I've been really trying to fix my attitudes and my moods. I have. Now, some days I'll be having good days. I really do. So until then, make sure y'all give me an update. Ta-ta for now. I know what my flow goes.